3 pills are sitting on your nightstand right now, and one of them could drop your blood pressure so fast tonight, you'll hit the floor before you reach the bathroom. I'll show you which one and exactly how to stay safe. If you take Losartan, Valsartan, Amlodipine, or Metoprolol, this video is for you. These are 4 of the most commonly prescribed blood pressure medications in the country. Millions of people over 60 take at least one of them every single day. And here is what I see in my practice again and again: patients who take their pill faithfully every morning, who do everything right, and still end up confused, scared, or hurt because nobody sat down and explained what this pill is actually doing inside their body. Not what it's called, not what dose you're on, what it is doing, how it works, what it can't handle, what it absolutely should never be mixed with. And the one specific question, that can change how safe you are on this medication starting tonight. Before we go further, tell me in the comments, how old are you and what city or state are you in? I read every single comment. It helps me know who's watching and what you need most. 70% of adults over 65 have high blood pressure. That means most of us sitting here have a pill in our organizer. And most of us got handed that pill with about 45 seconds of explanation. If you haven't subscribed yet, please do that right now. Every week, I put out clear, honest health guidance made specifically for people over 60. No complicated language, no scare tactics, just the things you actually need to know to stay safe and feel good. Hit subscribe. It takes 2 seconds. You'll be glad you did. Now, these 4 medications all lower blood pressure, but they do it completely differently. Treating them like they're interchangeable is like thinking all cars go the same speed just because they all have 4 wheels. Here's the plain English breakdown. Losartan and Valsartan belong to the same family. They're called ARBs. Think of your blood vessels like a garden hose. There's a hormone in your body called angiotensin that grips that hose and squeezes it tight. Blood pressure goes up. Losartan and Valsartan block that grip. They tell that hormone, step back, let the hose relax. Blood pressure comes down. This matters enormously because Losartan and Valsartan are cousins from the same family, and your body can only handle one of them at a time. Taking both, even accidentally, is not double protection. It's double pressure on your kidneys and double risk of your blood pressure falling too low. If you have both names on your medication list, even from different doctors at different visits, bring that list to your next appointment and ask specifically, should I be on both of these? Now, amlodipine works by a completely different mechanism. Your blood vessels have tiny doors in their walls called calcium channels. When calcium flows through those doors, the vessel squeezes tighter. Amlodipine blocks those calcium doors. It says, stay closed. The vessel stays relaxed. Blood pressure stays lower. The most common side effect of amlodipine shows up in your ankles. When those vessel walls relax, fluid can shift into your lower legs. It pools there. Your socks leave marks. Your shoes feel tight by evening. This is not heart failure. It's not kidney failure. It is a known, documented effect of this medication, especially after a dose increase. It does not mean you're getting worse, but it also should never be ignored if it's new, getting worse, or if it comes with shortness of breath. That combination needs a call to your doctor today, not next week. And then there's Metoprolol, and this one is the most misunderstood of the 4. Metoprolol is a beta blocker. Your heart has receptors, like little switches, called beta-1 receptors. When adrenaline hits those switches, your heart beats faster and harder. Blood pressure rises. Metoprolol covers those switches. Adrenaline knocks, but nothing happens. The heart stays slower, calmer, lower pressure. In a moment, I'll tell you why stopping Metoprolol suddenly can be dangerous, even if you feel perfectly fine. I want to tell you about a patient I'll call Barbara. Barbara was 72, a retired nurse, sharp as a tack and organized. She was on amlodipine for her blood pressure. Her cardiologist increased her dose from 5 milligrams to 10 milligrams at her last visit. 2 weeks later, she noticed her ankles looked puffy by dinner time. Her socks were leaving red rings. She stared at her legs in the bathroom and thought, is this my heart failing? She didn't call. She watched and worried for 4 weeks. She cut back her evening walks because she felt uncertain. She lost sleep. When she finally came in, I told her, this ankle swelling has a name. It's called peripheral edema from vasodilation. Her blood vessels had relaxed so well, the medication was working beautifully. That fluid had shifted into her lower legs. We adjusted her dose. We added a conversation about when to call versus when to wait. The swelling improved, and she got 4 weeks of sleep back. The lesson from Barbara: when your doctor hasn't warned you about a side effect, you fill in the blank with fear. Our job today is to fill in every blank with the truth. Now let's talk about how to stay safe on these medications. Let's go back to that nightstand. Any of these 4 medications, but especially amlodipine and metoprolol, can cause something called orthostatic hypotension. That is what happens when you stand up and your blood pressure drops too fast. The room spins, your vision grays at the edges. And in the dark, with a throw rug, with tile, at 2 in the morning, that is how a fall happens. Falls are the #1 cause of injury death in adults over 65 in this country, and blood pressure medication is one of the documented contributing factors. This is not a reason to stop your medication. It is a reason to change one habit tonight. When you wake up at night, sit on the edge of the bed for a full 30 seconds before you stand. Feet on the floor, hands on the mattress, 30 seconds, let your body adjust. Then stand, turn on a light, take the throw rugs out of the bathroom floor, and if you've had dizziness standing up more than twice in the last 2 weeks, that conversation needs to happen at your next appointment or sooner. Every time your doctor increases your dose, whether it's Losartan, Valsartan, Amlodipine, or Metoprolol, the next 3 days are the most important days to be careful. Your body is adjusting. These are the days to stand up slowly, to stay hydrated if your doctor allows it, to pay attention to how you feel that first morning and evening. If you feel dizzy or lightheaded, sit down immediately. Don't try to push through it. And if it happens more than once, call your doctor's office before assuming it will pass. Now here's something that surprises patients every time. What does a stomach bug have to do with blood pressure medication? Picture this. It's February. You wake up with a stomach virus. You haven't kept food down since yesterday. You're barely sipping water. And you do what good patients do. You take your Losartan at 8 in the morning, same as always. By noon, you're shaky, pale, and your blood pressure reads 90/55. What happened? The medication didn't change. Your body did. When you're dehydrated from vomiting or diarrhea or illness, there's less fluid in your blood vessels, less volume to push. The medication that normally fits your body perfectly now hits much harder. Your pressure drops too low. This is why every patient on Losartan, Valsartan, or Amlodipine should have a sick day plan, not a self-made decision to stop the medication. A pre-agreed plan with your doctor. Something like, if I have vomiting or diarrhea lasting more than 8 hours, I call the office before taking my next dose. Ask your doctor this week, what's my sick day plan? 3 words. It could save you a hospital visit. Now I want you to walk to your kitchen after this video and look at your salt substitute. Turn it over. Read the ingredient list. If you see potassium chloride and you take Losartan or Valsartan, this is important for you. ARBs like Losartan and Valsartan can raise the level of potassium in your blood. That's usually fine when everything is in balance. But potassium also comes from salt substitutes, from certain supplements, and from other medications. When it stacks up too high, it can cause muscle weakness, irregular heartbeat, and in severe cases, a dangerous heart rhythm. This is one of the cruelest medication traps I know because it punishes people for trying to be healthy. They switched to the salt substitute because someone told them to eat less sodium. Nobody connected the dots. The fix is simple. Talk to your doctor about whether a salt substitute is safe for you specifically. If your doctor runs blood work that checks your potassium level, which they should be doing periodically on an ARB, that's exactly why. Now let's talk about over-the-counter medicines. You could be perfectly faithful to your prescription and still undo all the work it's doing. Most people are very good about taking their prescription. Then they go to the pharmacy and pick up ibuprofen for their knee, a decongestant for sinus congestion, and a natural supplement they read about online, and their blood pressure starts climbing again. NSAID pain relievers like ibuprofen and naproxen can reduce how well Losartan and Valsartan work. Cold medicines with decongestants can raise blood pressure on their own. And the word natural does not mean safe with your prescription. Here is the single thing your pharmacist wants you to ask, and almost nobody does. I take this medication. Is it safe to add this? That's it. Every time. Before anything new enters your body. 5 seconds at the pharmacy counter. It's free. It could prevent a very bad week. Now let's talk about Metoprolol specifically, because this is where I need to be honest with you. There is information online that says beta blockers like Metoprolol are not the first choice for blood pressure. And that's partially true for simple high blood pressure with nothing else going on. But most people over 60 on Metoprolol are not in that situation. They had a heart attack, they have a rhythm problem, they have chest pain with exertion, they have heart failure. Metoprolol in those situations is doing a specific protective job. Stopping Metoprolol suddenly can cause your heart to rebound, and that rebound has landed people in the emergency room. Here's what happens. Your heart has adjusted to working in a quieter, slower environment. When you remove that protection suddenly, your heart gets flooded with adrenaline signals it's been shielded from. Your heart rate surges. Blood pressure spikes. Some people develop chest pain. Some end up in the emergency room within 48 hours. If you ever want to stop Metoprolol, have that conversation with your doctor first. It's a legitimate conversation. Just have it before you act, not after. And one more thing about Metoprolol, if you have diabetes, it can mask some of the warning signals of low blood sugar, particularly the pounding heartbeat that normally alerts you. Talk to your doctor about what other signs to watch for. Before we get to the most important part, I want to ask you something. Of everything we've covered so far, which one hit closest to home for you? The fall risk? The sick day problem? The salt substitute? The OTC medicines? The Metoprolol situation? Drop one word in the comments. Just one word. I want to know where to go deeper for you next. Now, I want to talk about something that has nothing to do with pharmacology, but everything to do with how safe you are on these medications. Many of my patients feel shame when their doctor adds a second blood pressure medication, or a third. They say things like, I must have really let myself go, or the first one just isn't working. I want to be direct with you. That shame is based on a misunderstanding. High blood pressure in most people is not caused by one thing. One medication may relax blood vessels, another may block a hormonal signal, a third may reduce fluid load through the kidneys. These are not competing medications. They're a team. Some of the most effectively managed blood pressure patients I have ever seen are on 3 medications, and their pressure is beautifully controlled. That is not failure. That is precision. I want to tell you about a man I'll call Robert. Robert was 74. He'd been on Losartan for 4 years. He never missed a dose. He checked his blood pressure at home every morning. He was, on paper, a model patient. But at his appointment last year, he sat down and said something that stopped me. He said, I honestly couldn't tell you why I'm on this pill. I just take it because I was told to. 4 years. Every morning. A pill he took faithfully and had never truly understood. We spent 20 minutes answering 5 questions he'd never thought to ask. And when he left, he said, I feel like I've been driving a car for 4 years and I just found out what the engine does. Here are those 5 questions. Write them down if you need to. Question 1. What is this medication primarily protecting me from? Question 2. What side effect is most common for this specific medication and what should make me call you? Question 3. Is there anything I eat, drink, or take over the counter that could interfere with this medication? Question 4. What's my sick day plan? What do I do if I'm vomiting or can't keep fluids down? Question 5. Is there anything about my blood pressure I should track at home and what numbers should prompt a call? 5 questions. That's the whole checklist. You don't need to memorize everything. You just need 5 answers, specific to your body, your history, and your prescriptions. Your doctor has all 5. You just have to ask. And now the point that ties everything together. The most common reason people stop their blood pressure medication is because they feel fine. And I understand that. If you feel good, the pill feels unnecessary. But high blood pressure is called the silent condition for a reason. It does not give you pain. It quietly damages blood vessel walls over years. The damage is happening whether you feel it or not. You feel fine on your Losartan because Losartan is holding the door. The moment you stop and you feel fine for a week, the door has not disappeared. The pressure behind it has just started building again. Never stop or change your blood pressure medication without telling your doctor first. Not because I'm trying to control what you do, but because stopping properly, with a plan, with monitoring, is completely different from stopping quietly and hoping for the best. Your heart has been working every second of your life. The least we can do is pay attention to the 1 or 2 pills that are helping it work better. Let me bring this home. If you take Losartan or Valsartan, watch your potassium, check your OTC products, and have a sick day plan. If you take Amlodipine, ankle swelling is common, dizziness is real, and the 30-second nighttime sit can protect you. If you take Metoprolol, know the specific job it's doing in your body and never stop it abruptly. And for all 4, ask those 5 questions at your next appointment. You deserve full answers. Drop 1 word in the comments right now. Ready. That's your commitment to ask at least one of those 5 questions at your next doctor's visit. Just 1 word. And if this video helped you today, please share it with someone you love who's managing their blood pressure. They deserve to know this too. Subscribe if you haven't. More videos like this every week. Next week, I'm covering the 5 foods that interact with blood pressure medication, including one that most people over 60 eat every single morning without knowing it could affect their pill. Make sure you're subscribed so you don't miss that. Take good care of yourself. I mean that. The information in this video is for educational purposes only and does not constitute medical advice. Always consult your physician or pharmacist before making any changes to your medications or health routine. This script was developed with AI-assisted writing tools and reviewed for educational accuracy.